This is the skull. This is norma frontalis. This is norma verticalis. This is norma lateralis. And this is called norma basalis. Norma verticalis, this is the frontal bone. Two frontal bones, they join in the middle. This midline suture is called metopic suture. The second one, this is orbit. This is supraorbital margin, and here you have a foramen or notch, supraorbital notch, and inside you are having inferior orbital fissure. Okay, both the sides you have inferior orbital fissure. This infraorbital notch, and this is called infraorbital foramen. You can see the foramen here, infraorbital foramen. And then this is called, this is nasal bone, and this is maxilla, and this is zygomatic bone, and this is called alveolar process, and this is called vomer. Then when you go laterally, this is the area very important. It is called as styrion. Behind that you have the middle meningeal artery. If you see this, you can see this is the outer aspect. This is styrion. Inside that you can see the branches, the impressions of middle meningeal artery. So this is the area where your middle meningeal artery lies. This is also called as gunshot point. And the next one is the sutures. Okay, this is sagittal suture, this is coronal suture. Both the sutures, they meet in the midline, that is called pregma. In newborn, it is called as anterior fontanelle. Anterior fontanelle fuses at 18 months of age or 1.5 years, and if it is depressed, the baby is dehydrated. If it is elevated, there is increased intracranial pressure. And then down, the styrion already we have seen. This is parietal bone, this is temporal bone. Only this area is called temporal bone, and behind that you have the occipital bone. This is called occipital bone. The lower portion is called occipital bone, and you have external occipital protuberance, superior nuchal, highest nuchal line, superior nuchal line, and inferior nuchal lines are there. This is external occipital crest, and this is foramen magnum, and this is mastoid process, and this is styloid process. This is external acoustic meatus, and this is the area called suprameatal triangle. Beneath that you have the mastoid air cells, and then these are the boundaries. Superiorly suprameatal crest, and inferiorly you have the posterior superior margin of external acoustic meatus, and then the tangential line connecting these two. This is the triangle. 12 millimeters beneath this you have the mastoid air cells, and this is the mastoid process, and then there is a notch behind that, that is called mastoid notch. That mastoid notch is for the posterior belly of digastric, which is coming from here. Okay, posterior belly of digastric. And then this is styloid process. Between the styloid process and the mastoid process you have a foramen, that is called stylomaster foramen, for the exit of facial nerve. And then this fossa is mandibular fossa for the articulation of head of the mandible. We'll move on to the base. This is palate, this is alveolar process, and then if you go beneath, here you will be having the plates. These are pterygoid plates. This is lateral pterygoid plate, this is medial pterygoid plate. On the upper margin of the medial pterygoid plate there is something called as pterygoid hamulus. Tensor veli pallatae muscle, the tendon winds around this pterygoid hamulus, and then between these two, this is the area for the auditory tube. And then go down, you have, this is the area where you have the pharyngeal tubercle, where the pharynx is attached, and then both the sides foramen lacerum is seen, and this round, nice, the round structure, it is called as carotid canal, and this is called jugular notch, carotid canal, jugular notch. And then styloid process already done. Occipital condyles, this is posterior condylar canal for the emissary vein. Anterior condylar canal is in the front, that is also called as hypoglossal canal, that is for the hypoglossal nerve. And this is foramen magnum. Many structures pass through this foramen magnum. That's all. This is the lambda suture. Okay, this is the area where the parieto-mastoid and the lambda suture meets. It's called as asterion. Then we'll move on to this base. Here there is a frontal crest, and this is crista galli, and this is foramen cecum for the emissary vein. This is cribriform plate of ethmoid for the olfactory nerves and vessels, and this is lesser wing of sphenoid, the entire thing. This is called as greater wing of sphenoid, and then here is the foramen optic canal for the optic nerve and the ophthalmic artery, and beneath that you can see a fissure that is called superior orbital fissure. Many structures are passing through the superior orbital fissure to enter into the orbit. Okay, it is entering into the orbit. And then next one is this foramen. This is foramen rotunda. This is foramen rotunda. This is foramen ovale, and this is called foramen spinosum. These three foramen are together one by one. Rotunda, ovale, oval shaped, and it is called spinosum. Okay, rotundum, through that maxillary nerve passes through this, ovale mandibular nerve, and spinosum middle meningeal artery and nerve spinosus passes, or the structures passing through this. And this is the pituitary fossa. Beneath that you have your sphenoid layer sinus, and pituitary gland is sitting over here and located here. Both the sides you have the cavernous sinus, and here along the lesser wing you have the sphenoparietal sinus, and this is the anterior clinoid process where the free margin of tentorium cerebelli is attached, and this is petrous part of the temporal bone. This is the apex posterior clinoid process where the attached margin of tentorium cerebelli is attached, and here is the Meckel's cave where the trigeminal ganglion is situated, and this is the groove for the superior petrosal sinus. This is the groove for the inferior petrosal sinus, and this part is called tegmen tympani. Beneath that only you have your middle ear and internal ear. That's why this meatus is called as internal acoustic meatus. This is present in the posterior surface of the petrous part of temporal bone. And then down you have the jugular foramen. This is jugular foramen. This groove is called as for inferior petrosal sinus. This is for superior petrosal sinus, and this is for inferior petrosal sinus. This inferior petrosal sinus also draining into the internal jugular vein. And then this is the transverse sinus, the sulcus. Here inside that you have the transverse sinus is situated, and this one is for the sigmoid sinus. This groove, the transverse sinus goes here and then continues here as sigmoid. Sigmoid ends in the superior bulb of internal jugular vein. So this is how internal jugular vein is formed, and this is the foramen magnum. This is the internal occipital crest. Okay, this one, and here is attachment for the fox cerebelli, and internal occipital protuberance. Transverse sinus already showed, sigmoid sinus showed. Okay, foramen next is this, the lacerated foramen on both sides. This is called as foramen lacerum. This is called foramen lacerum, lacerated foramen. That's why it's called lacerum. Okay, that's all about the skull. You can see the impressions of middle meningeal artery over here. That's all.